Dear participants, hello. We're starting our meeting, our webinar. And the topic of the webinar is the syndrome of chronic fatigue, breathing and aromas in the prevention of chronic fatigue syndrome. My name is Sergei Zinatulin. I've started dealing with rehabilitation in 1987. And the main branch of my performance was the implementation of regulation techniques of breathing, and also implementation of essential oils, aromatherapy in the form of inhalation. It is an aromatherapy in its optimal form, inhalation of essential oils through nose. And my experience showed that it is important to combine in our practice regulation of the breathing and aromas. It took us several years to develop a special aroma respiratory training. I was especially interested in this methodic because I started to work as a psychiatrist. And aromatherapy is kind of a mild method of regulation of nervous system. It almost doesn't have any contraindications, just as well regulation of the breathing. Of course, if we have a complementary methods of unbiased assessment of the aroma respiratory training, we get better and more accurate results and safer therapy. In our practice, as a tool of objective and unbiased measurement and assessment of the training, we use the hardware and software complex VedaPulse. Our English-speaking participants have the presentation in English available for downloading. Of course, there are some authorities in the history of development of aroma and breathing therapy, and we have the Leighton Brian Miller, one of the authorities, writing in his book that almost all diseases, one way or another, are associated with pranavata disorder. So breathing exercises and aromatherapy are effective for any ailment. Yes, we're talking about any ailment. They may be associated with nervous system or any internal organ. And today we're going to discuss the chronic fatigue syndrome, which is kind of a mysterious or enigmatic disease. The patients, the people suffering from this disorder usually have a lot of complaints, the wide range of complaints, but their lab tests are usually fine. You know that popular saying that all the diseases come from nerves. And we understand that if we want a person to be healthy, it is necessary to provide the healthiness of central nervous system, first of all, of his psychic state and emotional state. And it is important that the cells of our body get enough of energy. And the supply of energy to cells is directly associated with breathing. In the first part, we will discuss the most important issues of association of breathing, aromas, and nervous system. And the second part will be about chronic fatigue syndrome features, aroma respiratory training program, and psychogenetics. So if we talk about brain, the brain is the organ that consumes a huge amount of oxygen. And the intensity of oxygen consumption by the brain is 10 times higher than the average intensity of oxygen consumption by the body. Of course, if the brain doesn't get enough oxygen, its functioning gets worse. So if we talk about some figures, some numbers, we see that in a person whose weight is about 63 kilos, the portion of brain mass is 1 kilo and 4. And also we can see here the oxygen consumption as of an organ. It is important and interesting that brain consumes oxygen of the same amount during sleep and during awakening. The process of breathing is regulated by the activity of the brain. We know that there is a special structure in the brain called the respiratory center. This center gets the signals from the special receptors that control the content of oxygen and gas in the blood. And this center is also dependent on our voluntary decisions. It means that we can regulate our breathing, we can govern it. And we all know that our breathing changes during our speech or singing or movement. It is interesting that breathing is the process that can be controlled by the person voluntarily starting 3 and 4 years of age. And that is why some traditional Chinese techniques and other oriental branches of medicine, including Qigong, Wushu, yoga, determines the respiratory practice as one of the main branches of health system. And also martial arts, such as karate, for example, the tutors of karate finds the respiratory training and to teach the person how to breathe correctly is one of the most important things. And it is explained by one simple rule: the breathing is energy. It is important to know that respiratory center, and we can see here it by number 2 in the picture. It has a special position and special role in the structures of the brain. And its activity directly associated with the centers that rule the cardiovascular system. And those of you who have VedaPulse complex or VedaPulse program can see it in the picture, like in the practice, illustrated in the program. When you change the breathing technique, you see the changes in the heart rate variability. And you would also notice the change in the major parameters like total power and dosha balance, because the breathing harmonizes all the parameters. And on the picture, we see the inner divisions of the brain. And one of the important structure here for us is the first one. It is ascending, activating reticular formation of the brainstem. It is have activating effect on the inner structures of the brain and on the general tonus of the body. And if we can regulate our breathing, we can optimize this management. Or we can get an effect of relaxation, of calming. Those effects are associated with different structures of the brain, including the reticular formation of the brain. It is important for us that our organs, our body, is ruled by the vegetative nervous system that has 2 divisions, parasympathetic and sympathetic division. Parasympathetic is a soothing or relaxing division, and sympathetic division, which is responsible for activation, and VedaPulse shows it in a very good form. It was scientifically proved, and VedaPulse shows it clearly, that with inhalation we get the activation of sympathetic nervous system. And by the way, I'm often asked the question about yawning. The people ask me why people have to yawn. There are several interesting theories on this account, and one of the theories is that with yawning the human brain gets cooled. But for me, it is obvious that when we are yawning, we make this deep inhalation that activates sympathetic nervous system. And this helps us to relieve the fatigue and slackiness of our state. So we said that with inhalation, we increase the activity of sympathetic nervous system, and this is mobilization of the body. And the exhalation gives us the controversial effect. If the exhalation is slow and relaxed, we get the opposite effect, meaning that the parasympathetic system is getting activated. And this is what we need for relaxation and restoration. That is why if we change the proportion between duration of inhalation and exhalation, we use our breathing just as a conductor who rules the orchestra. That is why I usually say that breathing is a golden key to the health. We only need to know what side to turn it. So we can say in general that increased inhalation time helps to mobilize the entire nervous system, and the lengthening of the exhalation time with the pause after exhalation has a calming effect. And I draw your attention specifically to the fact of lengthening of the duration of inhalation or exhalation. If we increase the time of inhalation or exhalation, we increase the time of total respiratory cycle. But the frequency of breathing gets smaller. It means that our breathing becomes more economic. And this is the typical feature of techniques that are used in the Oriental medicines. And all the basic meditation programs presume that breathing frequency and breathing should be less frequent. So we say that breathing helps us to regulate the state of vegetative nervous system and organs as a result. Here is the example from the practice. Those who use VedaPulse understand that those screenshots are from the program. On the left, we see the screenshot of the state before the regulation of breathing. We can say that this state is quite fine, the balance of vegetative nervous system, but only 5 minutes of respiratory training where we gave 5 seconds to inhalation and 5 seconds to exhalation brought the state of the person to ideal condition. And further, we'll see even the more interesting example. You should pay attention to the fact that breathing is performed through the nose. If we're talking about such a common and popular problem as stress, psychophysiologists and Guy Hendricks, my colleague, is one of them, saying that regulation of breathing is one of the most convenient and safest way to rule the problem of stress. And Hendricks notes that proper breathing literally washes the tension out of the body, reduces the level of stress. And the National Institute of Health of the United States issued the special recommendations on breathing that are called WISE Air. And I can say as a psychiatrist is that this knowledge is highly important, thus important that we should include it into the school program. It is a culture of health and would be very much beneficial for prophylaxis of many diseases. And this is an example that illustrates what Hendricks said, and this is a screenshot from our experience. It illustrates how breathing regulates stress situations. On the left screenshot, we see the obvious state of extreme tension of the sympathetic nervous system. This is a stressful episode. And the technique was, the duration of the whole training was 7 minutes with inhalation of 5 seconds and exhalation 10 seconds and breathing frequency 4 per 1 minute. And we can see that only after 7 seconds, only after 7 minutes, the whole picture of the state of the person changed drastically. It means that the person left this stressful condition, and if he or she will conduct such trainings more during a day, like 5 times a day, we may say that he will get out of this stressful situation without any remarkable changes for his health. And if we do not do anything with this tension, it may lead to further changes and even some chronic situations. So aromatherapy and senses or odors, fragrance. The importance of aromas for human health was noted long ago, and Ayurveda says a lot about this. But only in 2004, the scientific studies in the field of influencing of aromas on human health was noted by a Nobel Prize. We know that nasal cavity have special cells, receptors. They react to all fragrances that come into the nose. And the impulses go to the special nervous centers that regulate the state of inner organs. In general, this whole system is called the limbic system. But also this information goes to the higher olfactory areas of the cerebral cortex. That is why we have this opportunity or option of choosing the fragrances that are preferable for us, that feels like nice for us or unpleasant. Smell preferences determine our individual peculiarities and features. This principle lies in the basis of aroma diagnosis. Essential oils have quite a complex compound. The basic elements is carbon dioxide, oxygen, and for example, geranium essential oil contains about 300 components, and bergamot, lemon, and mandarin essential oils or tangerine essential oils contain about 500 components in each. And we say that this is an ester oil, but we should remember that this essential oil is a complex cocktail. Each essential oil has a variety of effects. But what is most important for us is that essential oils has this special function of optimization and of adaptation mechanisms, and they affect central and vegetative nervous system. The studies show that we have special smell analyzing system. And to get the actual impulse generated in the olfactory tissues, we have to get not less than 8 or 10 molecules of odor coming into the nose. And for a person to get this actual smell sensation and emotional response to the fragrancy, not less than 40 nervous fibers should be excited. And we have this almost momental or instant reaction from our response analyzing systems. According to Ayurveda, our nose is a door to the brain. This is quite an interesting way of looking at breathing and smells as a tool of influencing the brain. And also nasal breathing determines the quality of circulation of blood along the arteries and circulation of cerebral spinal fluid of liquor. If we breathe through the mouth, those influences decrease drastically. And of course, if we breathe through the mouth, the molecules of odor or fragrance do not get into our olfactory receptors. So if you have this situation when you only can breathe through the mouth, you should rule out this situation. And you should visit the doctor who deals with the problems of nasal cavities and ears. And also the influence of breathing on our psychophysiological well-being was interestingly noted by Richard Miller in Yoga Journal. He noted that breathing with diaphragm improves self-esteem, emotional stability, confidence, attentiveness, and awareness about things going on around the person. And chest breathing, on the contrary, makes it difficult. And here we face the myth of 3 types of breathing. In the state of rest, in norm, the person is supposed to breathe with diaphragm. The diaphragmal breathing reduces anxiety and phobic behavior, the Miller note. And chest breathing may be used during physical exertions, during physical exercises, and maybe during singing. But we also know that professional singers are taught to breathe through diaphragm. It is a so-called the lean on the diaphragm. And reduction of frequency of breathing to 6 cycles per minute decrease the tension of the regulatory systems. If we have 6 cycles per minute, it means that one cycle lasts about 10 seconds. If a person is healthy, if the respiratory system is healthy, we do not have bronchial asthma or any other severe diseases of respiration, we can reach this level of proper breathing after a month of regular trainings. It's not difficult. It is accompanied by optimization of sympathetic and parasympathetic balance of vegetative nervous system, and general relaxation of the body. Now we're having a technical break for 5 minutes. And after that, we're having a second part of our webinar on the topics, the chronic fatigue syndrome, aroma respiratory training programs, and psychogenetics. So we're talking about a chronic fatigue syndrome or fatigue syndrome. This is a disorder that appeared to be an official disorder not that long ago. One of the main features of the disease is an inexplicable feeling of fatigue and weakness throughout not less than 6 months in a row. And even a prolonged vacation, for example, if a person has a vacation that lasts for a month, doesn't change the situation. In the end of the 20th century, the scientists started to study this syndrome closely. In the United States only, there appear to be about 100,000 of cases, and 80% of those people were women. Because of that, there was decided to found a national center for chronic fatigue. It was especially important because the syndrome was, from this syndrome was suffering young people, most able-bodied people of those professions that require intelligence and higher intellect. And people of those professions that demand emotional stress, higher responsiveness and wit, such professions as doctors, teachers, for example. And the age span of those people is the most performable age, if we may say so. It is from 25 to 45 years of age. The studies took several directions, and one important thing was found that in these people who were suffering from syndrome was noted a well-expressed imbalance of the immune system. It was generally described as a non-specific activation of the imbalance of the immune system with the reasons unknown. And the combination of problems with nervous system and the immune system at the same time gave the further name for the disorder. They started to call it a chronic fatigue syndrome and immune dysfunction. As we said, there was found a national center of fatigue syndrome. But today we have the Institute of Chronic Fatigue Syndrome performing in California, USA. And according to Professor Goldstein from this institute, the disease is caused by an undetected virus. And Professor Goldstein defines chronic fatigue syndrome as a multi-cause disorder of neuroimmune mechanisms which manifests in genetically predisposed individuals. And we get the activation of infectious agents of the immune system and dysregulation of central nervous system. And also there is a impairment of temporal limbic region of the limbic system. So what we can say in short about chronic fatigue syndrome is that there are different criteria, major and minor. To major criteria, we can say that it is an unmotivated fatigue and decreased performance and motor activity, not less than by 50%. The reduction of activity and performance not less than by 50% in previously healthy adults for over past 4 months and in children for the past 3 months. It means that here we're talking already about the presence of the syndrome in children and teenagers. And other major criteria is that there is an absence of any other causes or diseases that may trigger chronic fatigue. What diseases can cause chronic fatigue syndrome? It is chronic renal failure or the lack of nutrition or the lack of vitamins. Minor criteria are increase of the temperature of the body up to 38 degrees Celsius, sore throat, and slight increase of lymphatic nodes. Those are specific lymph nodes that are situated in the neck and in the shoulder region. Also, there is a presence of unexplained generalized muscle weakness, muscle pain, myalgia, and pain in the joints manifesting as polyarthralgia, and also sleep disorders and neuropsychological disorders. If we're saying objectively that the doctor can describe as a impairment, general impairment of health, something that we call a subfebrile or low-grade fever. It is a moderate increase of the body temperature, and also pharyngitis, non-exudative. It means that there is no pus inflammation. And also the increase in the size of lymph nodes. This is the state when the person doesn't feel well, and there are a lot of complaints. The person generally feels bad. We said in the beginning that for the person to feel well, it is important for the cells to get enough of energy. And one of the studies showed that the body of the person with the chronic fatigue syndrome is emaciated on the cellular level. And the scientists of the Newcastle University studied the oxidative phosphorylation and glycolysis, the stages of cellular respiration leading to the synthesis of adenosine triphosphate. As we know, the adenosine triphosphate is the source of energy in our cells, and it turned out that the cells of people suffering from chronic fatigue syndrome have these cells producing the adenosine triphosphate twice less than normal people do. It means that the people have the emaciation or deficiency on the cellular level and the lack of energy. That is why the scientists suggested another name for the disease or for the syndrome is a systemic disease of stress intolerance. It means that the person doesn't have enough of energy to suffer the stress, to tolerate. We can say it is a deficiency of energy. It is important to pay attention to the opinion of one of the authoritative specialists in this field. He is Dr. Sheldon Sol Handler, and in the book, The Oxygen Breakthrough, he wrote that ATP, or adenosine triphosphate, is the basic currency of life. Without it, we're almost dead. And dealing with this problem for a long time, he came to the conclusion that the breath is that what first and not least that the person should pay attention to if he or she suffers from fatigue and diseases of energy imbalance. And now we're going to talk about aroma respiratory training in the prevention of the chronic fatigue syndrome. We remember that breathing helps us to regulate the state of vegetative nervous system, and essential oils help us to regulate the tone, the general tonus of the body, and also regulate the nervous system. Aroma respiratory training, or ART, is a combination of breathing exercises and aromatherapy in one session. But it is more correct to say not breathing exercises, but regulation technique of the breathing. Because when we say breathing exercises, people imagine right away something active, like active breathing with active manipulations with respiratory system and so on. At some point, we can compare aroma respiratory training with meditation. It is important for you to conduct the sessions of aroma respiratory training in a calm atmosphere, that you perform slow inhalations and exhalations through the nose. It is important that you focus your attention on the smell, that you understand the smell. Usually 10-15 minutes is enough for the session. If you have such an opportunity, you can conduct 3 or even 4 sessions a day, but there should be a break between the sessions of not less than 3 and 4 hours. And it should be a diaphragm breathing. That is why it is better to conduct the training in the position, in a sitting position or in a lying position. Even if you perform only an active chest breathing at the present moment, if you have an active chest breathing, it means that anyway you can develop diaphragmal breathing quite fast, and you should perform it. You should perform the exercises in a sitting or half lying position, because in a full lying position, there should be difficult to perform diaphragmal breathing. And of course, as a control or assessment tool, it is useful to use VedaPulse complex. And VedaPulse allows to see the breathing wave and use timer to regulate the breathing. And there is a question in the chat on what side it is better to lay when performing the exercise. It's hard to say, because for any person, for each individual person, it is personified. That is why it is better for you to try conduct some trainings lying on one back, on one side, and then, for example, on the right side and on the left side. The side position is, when you hold this side position, it is important to remember that there should be no tension in the spine. You should have a convenient cushion that would help you to hold a neck in a comfortable position with no overbending or anything. And the legs are half bend in knee and thigh. And to make it convenient to stay in one position, in side position for 15 minutes, you can put a thin, convenient cushion between your knees. Thus, you get the most comfortable, most convenient position that won't distract your attention from actual regulation of breathing and concentration on the smell. To choose the aroma correctly, you can use different sources of information. And according to the program, to the VedaPulse program, to the results got by the cardiointervallogram, there was developed a special aromatherapy program. It allows to take into consideration different parameters such as constitution of the person, his physiological peculiarities, and current diseases. It means that we would generate a recipe for aromatherapy for this particular person in this particular time. And of course, we can save this recipe, make this automatic conclusion, and save it. In general, aroma respiratory training can be divided into 3 different programs. There is a question in the chat about some universal fragrance that would fit any dosha or any person, and there are actually fragrances that suit or balance 3 doshas. For example, it is fennel. I cannot say more accurate information about cardamom, but I know that it is one of the most popular and actively used fragrances. And in general, if a person is leading a ordinary lifestyle, we need toning effect or toning oils in the morning. In the second half of the day, we need some oils that would bring regulation of the state, harmonization of the state. And of course, in the evening, when we're getting closer to sleep, we need relaxing and sedative effect. So the morning program, we need toning effect. So we make an inhalation, and we remember that by inhalation we activate the sympathetic nervous system. That is why it is important for us that duration of inhalation should be more than duration of exhalation. We can make short pauses after inhalation and exhalation. The duration of the pause 2-3 seconds. And the essential oils that can be recommended in general for the people, it is cedar, lemon, clary sage, and pink pelargonium. Cedar is one of the most powerful adaptogens. It is important and more efficient for the people who suffer meteorological influences, disturbances, magnetic disturbances, and desynchronisis. Lemon stimulates immune system and increases mental performance. Oil. Clary sage has a positive effect on patients with functional disorders of the nervous system, and those are people with chronic fatigue syndrome. Also, it stimulates the activity of central nervous system. It improves quality of work performed, and we remember that people who deal with chronic fatigue syndrome are all usually involved in the highly intellectual work. And just as cedar, clary sage has the capacity to improve the adaptive ability of the body. Pink geranium, we can say that at some point it is kind of a feminine oil, but it is all relative. In general, it stimulates neuromental activity, which is important in a chronic fatigue syndrome, and it improves the tone of cerebral vessels. It has a relaxing effect in the situation of stress. Here is another program, the Aroma Respiratory training for the afternoon time. This training has regulating and harmonizing effect. So we can see that inhalation and exhalation would be almost the same in terms of duration. Here we can recommend the basil oil, as it noted in several sources of information, Ayurvedic sources, that basil has a effect of cleansing or clearing the mind. Also, we can recommend peppermint, palmarosa, rosemary, and grapefruit. Of course, the choice of essential oils can be carried out with the help with Aroma program of VedaPulse, or as a test of aroma diagnosis on assessment of person's state. As for my personal experience, I highly appreciate basil as well as peppermint. And as to my personal opinion, I do not prefer palmarose. Interesting things about peppermint. It provides psychophysiological relief and removes emotional and nervous tension. And what is important for regulation, it balances the functions of both the divisions of vegetative nervous system. It means the balance or harmony between sympathetic and parasympathetic divisions, and also it has a positive effect on the cerebral circulation. Rosemary increases the general tone of the body, improves memory, relieves fatigue. It increases cerebral circulation, stimulates mental and physical performance, and focusing of attention, which is important for people suffering from chronic fatigue syndrome in the second half of the day. But it is not recommended for people who suffer from hypertension. As other citrus, grapefruit increases the release of neuropeptides involved in the transfer of nerve impulses. Palmarosa is an antidepressant remedy. It has adaptogenic and stimulating effect and increases mental performance. So it is an evening time when we finished our work and need to prepare our body for sleep. So the whole direction of our training here is relaxation and sedation. It means that we need shorter inhalation and longer exhalation with a pause after exhalation. But as we need sedative effect, we uh, drag the belly in only half inside. We don't need the full tension of the belly muscles. Here we can use lavender, anise, Chinese orange, tangerine, and bergamot.
Кстати, и ладан тоже можно.
And ladon, of course, too.
Вопрос был просто про ладан.
Lavender is quite an interesting oil and has an interesting history. If you were interested in the history of development of aromatherapy, lavender was the very herb from which the scientists started the researchers in the field of aromatherapy in general. And here for us, its sedative and anti-stress effects are the most important. And also its ability to improve the blood supply to the brain. And the patients suffering from cerebral or from chronic fatigue syndrome are often detected with impairment of cerebral circulation, mild impairment. Anise is known as a mild fragrance, which has a capacity or ability to relieve nervous and emotional stress and improve adaptive responses. And orange, tangerine, and bergamot have their general effects of antidepressant, calming, and soothing. It helps our body to prepare to sleep in a most smooth way. And it is well known that it is quite difficult, one of the most difficult for people suffering from chronic fatigue syndrome to fall asleep with no problems. And aroma respiratory programs, there were questions about respiratory cycles, and here all the answers in the programs. So the first program, activity and vigor. That is what we use in our morning program. It is a diaphragmal breathing through nose. And the general breathing technique here is inhale takes about 2/3 of the whole respiratory cycle, and exhalation takes about 1/3 of the whole respiratory cycle. And the easiest way to start is to make inhalation of 4 seconds and exhalation of 2 seconds. It means that the total respiratory cycle is 6 seconds, and we here have 10 breathings in 1 minute. In general, it is less than 14 breathings per minute or 16 minutes breathings per minute that are usually noted in people. And here you see that inhalation is almost 2 times longer than the exhalation. Further on, we can expand the duration of inhalation to 6 seconds and duration of exhalation to 3 or 4 seconds. And if everything goes fine, further, we can increase it to 10 seconds and 5 seconds. But do not be hasty, do not hurry to increase the duration of the cycle. If you remember in the beginning of the webinar, we looked at the scheme of the regulation of breathing. We talked about the breathing centers of the brain, and neurons of the respiratory center has the regime of breathing actually recorded in them. That is why it is important to change your breathing regime in a very much gradual mode. And also we said that respiratory center works along the circulatory system and cardiovascular system, and that regulation of breathing has a positive effect on the heart performance and heart rate. And that is why when you start regulate your breathing and start breathe with less frequency, it means that you breathe now calmly, which means that your heart starts work in a more calm mode. The heart rate may reduce by 4-8 times And also we regulate the arterial tension. And it is advisable to hold a journal or some kind of schedule with your patients. As a minimum, you would reflect in this journal the duration of the total respiratory cycle, duration of the session, and the frequency of sessions during the day. The next program is developed for tone and balance. Here we actually take our breathing to the balance mode when the duration of exhalation and inhalation in pause is actually the same. For example, we may get inhalation and exhalation in pause, all of them by 2 seconds. We also have here the respiratory cycle of 6 seconds with frequency of breathing 10 per minute. It is important for you to start with simple modes, with simple techniques, because it is essential that you learn how to regulate and feel your breathing. Further on, you can increase the duration. For example, first you increase the duration of inhalation by 1 second, then in 2 days you increase the duration of exhalation by 1 second, in other 2 days the inhalation, and so on. If you do not have any severe conditions of respiratory system, you can easily come or reach the mode of duration of inhalation and exhalation of 2 seconds.
Ну, через месяц, через два, как пойдет, тут нельзя 30 секунд, 2 дыхания в минуту.
It means that the respiratory cycle for you would be 30 seconds with 2 breathings in a minute. And I must warn you that you would notice that in some kind of trouble situation, you would breathe more calmly and less frequent than you used to breathe. It means that your respiratory center switched to the special autonomous mode of breathing. Our neurons has a memory, and they record in their memory this less frequent autonomous breathing. And of course, if you breathe less frequently, you save your energy. And energy is life. And in a chronic fatigue syndrome, energy is the most essential. There is a lack of energy, as we said. And the third variant of the program is the program aimed at relaxation and anti-stress effect. And this program is the opposite for the first program that we saw, because here, on the contrary, inhalation takes 1/3 of the whole respiratory cycle, and exhalation takes 2/3 of the respiratory. For example, breathing takes 2 seconds and breathe out takes 4 seconds. But I must draw your attention to the fact that this is supposed to be a calm breathing with no extra tension of the nose. And when performing such type of breathing, if you notice that you have this natural pause after exhalation, you can keep it for 10 or for 2-3 seconds, because this would be a part of a long exhalation. But it is not advisable to create this long artificial pauses. It arouses the respiratory center. It excites the respiratory center, and you lose the control over your respiration. And if we're talking about the effect of essential oils of the nervous system on neuromediators that influence nervous cells, it is important to say that lavender aroma helps to release serotonin and reduces cortisol levels. Jasmine aroma stimulates the release of endorphins, and endorphins are responsible for good mood, well-being. Neroli, lavender, and marjoram also are responsible for release of serotonin, which allows to greatly control emotional states and stress responses. And once again about peppermint oil, which I'm fond of. It decreases the amount of adrenaline, noradrenaline, and dopamine. Thus, we get the elevated mood, good mental state, and less aggressiveness. If we take Belgium as an example, it was a part of a scientific overview that actually in this flourishing country, there is a great part of people who live in this country usually take a paid sick leave because of this syndrome. Every year, about not less of 10,000 of Belgians take a sick leave for this reason. And Claude Hodris, a scientist, a professor of the Leuven University, said that scientists are trying to find so-called genes of stress or genes of burnout in the patients, the genes which are produced when the person experiences stress. Each blood cell contains about 23,000 genes, and few of them is activated by stress factors. In case they remain active, we get a chronic stress which can lead to burnout. In our practice, we use a special case or so-called psychogenetic program. James Watson, a Nobel Prize laureate, in 2008, it was 10 years ago, he already said that now we can work with DNA and search for the molecules responsible for behavioral control. The science undertakes to explain the things we do not get, such as behavior. And we selected a minimum number of genes and created or generated a list of genes that can be responsible for development of problems on a genetic level, problems with nervous system, emotions, and psychic states.
Он первый в списке.
And the first gene is the gene of alcohol dehydrogenase. It is associated with risks of ethanol metabolism, as well as hormones, neurotransmitters, and cholesterol. And apolipoprotein gene, APOE, it is associated with the development of lipoprotein, of the development of impairment of lipoprotein metabolism and such neurodegenerative disorders such as multiple sclerosis and Alzheimer's disease. It means that having some results on these genes allows us to form some recommendations in terms of diet for the person. And the next gene is COMT. It controls the enzyme that regulates the activity of adrenaline, noradrenaline, dopamine that are responsible for psychic states. And two genes that work in a combination, DRD2 and DRD4, the genes that encode dopamine receptors. Each of these genes has its own peculiarities and features, but in general, their activity determines the amount of dopamine that we produce and the duration of its stay in the body. The next gene is associated with the enzymes that regulate serotonin levels. Our activity depends on this, our pain sensitivity, our sleep and wakefulness. And a very much important and interesting gene, TNF-alpha. Here it is important for us as a gene responsible for sleep and wakefulness regime and also for transmission of nervous impulses. And besides the general recommendations on diet, we have generated recommendations on aromatherapy. You can send your analysis by mail. You do not have to present at the test. You do not have to give your blood for the testing. You also need to. You only need to send the cotton stick with the genetic material, and the genetic material would be presented by the buccal epithelium from the inner side of the cheek. This genetic material would be packaged in the sterile pack. And using the general mail, you would send it to our address. Our database has the results on people from all over the world, from United States, from Singapore, from Europe. On this matter, you would get an email letter with all the details described, and we have some time for answering the questions. We have talked in details about regulation of the breathing and duration of breathing cycles. If we talk about aromatherapy for children, this issue is usually solved in a personified manner. It means that we need to have a personal discussion. For example, you can send an email letter and we will try to help you. But if we say in general, it is important to pay attention to the fact that the child should have no distortions of nasal breathing. If the child is older than 5 years of age, it would be quite easy to teach him or her to regulate the breathing through game. There is a question what diffuser it is better to use. There is quite a wide choice of different diffusers, and a general thing that I can say about it, that it is important to bring the diffuser or the vapor exit of the device closer to the nose, that we get more molecules of odor coming into the receptors. I developed two devices, two inhalators or breathing simulators. They allow to carry out inhalation simultaneously by two nostrils. You can use a special mask. But if the inhalator is simple and allows carrying out inhalation or breathing only through one nostril, it is important that you alternate the breathing and use both nostrils. It is anyway important that we need to get as much oils, as much aroma as possible getting into the nose. And it is important to carry out slow breathing, because when we breathe calmly and slowly, the more volume of air comes into the upper nasal entrance. And it is important because in the upper nasal passage, we can say it is the furthest part of the nasal cavity, there is the major part of the receptors situated. If we talk about the usage of peppermint oil in Parkinsonism, I do not possess the detailed information, but in general I can say that it is better to start with the usage of mild oils. For example, we can use grapefruit oil. There is also a question in the chat, or what you would say on the usage of aroma necklace, not in the static state, but in a movement. My opinion, as our expert says, that the basic thing is to learn how to regulate the breathing in a static state, in a state of rest. What oils we can use, the mixtures of oils or pure oils, how many drops we can take per session. My personal experience, professional experience showed that any new influences on the body should be started with the smaller dosages. It is ideal that first 2 or 3 weeks you use one oil
В течение недели.
during a week. The good quality essential oils has a good capacity of evaporation. My personal experience showed that 3 drops is enough. 5 is more than enough, and more is not recommended. If you find yourself getting pleasure of using the mixture of oils, the second part of the course, for example, the second month of the treatment, can be carried out with the mixtures of oils. For example, you can mix several oils by 1 or 2 drops of each oil. If a person has the revolting reaction to a peppermint oil, what it can mean? It may mean that this oil doesn't suit your constitution. And also the question, can a person get dependent on aromatherapy? Can the person develop some kind of addiction? As we work with a natural remedy, natural oil, and it has a mild effect, it doesn't cause any rapid changes or drastic changes in the body. We do not have a basis to presume that there may be developed some addiction to aromatherapy. That is why you won't find such a section about addiction, in the description of aromatherapy in any manual. But I also described one important situation of one of my books 12 years ago. The people who live in cities, in big cities, and major part of citizens of Russia, and the major part of Russia does not have the flowering plants half of the year. We have this special state, as I call it, aroma deficiency. And different synthetic aromas cannot cover or cure this deficiency, it was proved. That is why we may say that if you carry out aromatherapy regularly, you would not get addiction, and on the contrary, you would get a basic healthy hygiene and prophylaxis of many diseases. Because, for example, we do not say that we develop addiction, for example, towards the teeth paste. If you want to obtain an inhalator, you can search for it in a drugstore, for example, or in medical tools shops. The duration of the course. It is known that new reflexes, new connections in our body are formed in average during 6 weeks. That is why it is advisable to hold regular respiratory sessions. It doesn't mean that you should perform them every day, but at least 5 times a week. And further on, you may see by choice. For example, yesterday it was a kind of powerful magnetic situation in the sun. Of course, it influenced the state of people. That is why it was important that 5 days prior such a situation and a week after the magnetic problem in the sun, you can carry out the aroma training. For example, another situation, you know that you would have a long trip from Russia to Latin America, and you would have a jet lag. You should take this break and carry out the last aroma training session 5 days before the trip, and another session 5 days after the trip. So you have this gap. We're out of time. I was happy to communicate with you. If you have any further questions, you can direct them by email. Thank you. Goodbye. And again, you will get an extra emailing with some details. Pay attention to it. And goodbye. Healthy breathing to you.